If you've been on the tough, often heartbreaking journey of trying to grow your family, you know how devastating it can be to hear unexplained infertility or to go through loss after loss. It can really feel like you've hit a dead end. But what if the answer isn't where you've been looking? I mean, really think about that for a second. What if the root of the problem isn't actually about your reproductive system, but it's hiding somewhere else? Somewhere that often gets missed in the standard workups. All right, we're going to go on a little investigation. We're going to uncover a hidden saboteur, a culprit that can quietly mess with your chances of getting pregnant, and it often does it without any obvious signs. You know that cycle, right? The one that's just full of endless questions and almost no answers? That's exactly what we're digging into today, because so many times there is a reason, and just understanding what it is, well, that's the first step to finding a completely new path forward. So who is this saboteur? Well, it's not some kind of outside invader. The attack, it's a case of mistaken identity. It's an inside job, launched from within your own body. Let's meet the culprit. Thyroid peroxide antibodies, or TPO antibodies for short. Now think of your immune system like an army. These antibodies are like soldiers who get confused. They're supposed to be protecting you, but they make a mistake and start attacking your own thyroid gland. This creates this constant low-level inflammation. And here's the kicker, the reason this gets missed so often. You can have these antibodies waging a war inside your body, all while your main thyroid hormone tests come back looking perfectly normal. It is the absolute definition of a hidden problem. Okay. So how on earth does a little gland in your neck, the thyroid, actually affect something as huge and complex as a pregnancy? The connection is actually surprisingly direct, and it is powerful. It all comes down to a two-pronged attack. On one hand, you've got these sneaky, subtle effects on the thyroid gland itself, and on the other hand, you've got a much wider-reaching impact on your entire immune system. Let's break that down. First up, even the tiniest bit of trouble with the thyroid can throw off your whole hormonal orchestra. Seriously. It can mess with the hormones that are supposed to trigger ovulation. It can make the lining of the uterus less welcoming for an embryo. It can even weaken those critical signals that your body needs to maintain an early pregnancy, and it can tank your progesterone levels. But it's more than just a thyroid issue. The presence of these antibodies is a giant red flag that your whole immune system is on high alert. This creates body-wide inflammation, which can damage egg quality, reduce blood flow to your ovaries, and basically turn the uterus into a hostile environment. And it doesn't stop there. It can even cause problems with how the placenta develops down the line. Now that all sounds pretty compelling, but what does the actual research show? Let's look at the numbers, because this is where the story becomes undeniable. The data is pretty jaw-dropping. Studies show that women with TPO antibodies have a 2 to 4 times higher risk of miscarriage or infertility. Let that sink in for a second. That is not a small number. That is a massive difference. And you can see this play out even with assisted reproduction. In IVF cycles, women who have these TPO antibodies consistently show lower pregnancy rates. It just goes to show you how powerful this immune response is. It can impact success even when science is trying to give nature a big helping hand. Okay, so we've identified the bad guy, we've seen the evidence, and I know that can feel really heavy. But the goal here isn't to create worry, it's to create power. So let's pivot. Let's talk about your action plan. You now have information that a lot of people, maybe even some doctors, don't know about or just overlook. This knowledge is your first and honestly your most powerful tool. So what's next? What do you do with it? All right, your path forward is actually pretty straightforward. 3 simple steps. Step 1, get tested. You have to specifically ask your doctor for a thyroid peroxidase or TPO antibody test. Step 2, talk to a specialist who gets the stuff, like a fertility specialist or an endocrinologist. And step 3, start supporting your own system. Adopt a lifestyle that helps calm that overactive immune response down. And here's a really concrete pro tip you can use. Many experts in this field recommend asking for that TPO antibody test if your TSH level is over 2.5, even if your lab report says that's in the normal range. That little piece of info can be a total game changer when you talk to your doctor. So what does supporting your system even mean? It really boils down to reducing that inflammation we talked about.
It starts with simple stuff, like making sure you're not low on key nutrients like selenium, vitamin D, and iron. It means eating more foods that fight inflammation, like berries and healthy fats. For some people, it might mean looking into potential triggers like gluten or dairy. And it's also about managing stress and maybe even exploring things like acupuncture.
So we'll end with this. After everything we've looked at today, the hidden culprit, the science, the clear action plan, the real question is this. Could shifting your focus from just thinking about fertility to understanding your whole immune system, could that be the key that finally unlocks your path to parenthood? It's a really powerful new way to look at everything.